experience eye strokes, they have a sudden painless loss of vision. And this would sometimes happen, most of the time in fact, only in one eye. Occasionally it could be both eyes. But when it's both eyes, you think about the brain more than just the eyes. But I think the most important point here is that you really need to seek immediate care. Because first of all, maybe there's something that's treatable, that you can actually provide treatment immediately. And also there could be implications that the decreased vision from an eye stroke could also be like a warning sign that you could have a brain stroke. So there are many different types of eye strokes, and eye stroke is like a general term that talk about poor circulation to different part of the eye. And you can have poor circulation to the retina, you can have poor circulation to the optic nerve. Of course, they could have different mechanisms, but basically often the symptoms is the same, is that you have a sudden loss of vision.
The vast majority are caused by clots that fly into the brain or into the eye. But sometimes the small vessels in the brain and in the eye close off in response to high blood pressure and as well as many other risk factors. And they cause different types of strokes. But the brain and the eye share the same types of mechanisms that cause vascular injury. Once the ophthalmologist diagnoses an eye stroke, they often refer these patients to a stroke center. It is important to go to the right stroke center because you can potentially receive medications that can unblock the artery that's responsible for the eye stroke. And this can be administered by vein and occasionally also through a catheter inside the carotid artery in the neck.
The risk factors are several. They include typically high blood pressure, diabetes, high cholesterol. Those are the major ones. And of course, we also worry about other type of unusual rare diseases. For example, one is called giant cell arteritis, and it's an inflammation of the arteries in older patients. And that, of course, is an emergency because that can decrease the vision rapidly and permanently.
The good news is that strokes are preventable. The vast majority are preventable. If you control your blood pressure, if you control your glucose levels and your cholesterol, if you exercise, you eat well, and you don't smoke or use excessive levels of alcohol or other drugs, then it is likely that you can avoid strokes of the eye and of the brain.